You'd think that the Health Ministry is one of the most important portfolios in the country, especially during this time of the global pandemic. A complex mission that requires an astute understanding of the medical world and the complexities surrounding it. Why then did the President choose the Tourism Minister to temporarily step into that role? William Gumede is on special leave after allegations surrounding tenders worth 150 million rand linked to communications company Digital Vibes. We know that she's a good cook. We saw that in her celebrity moment. But what can Mameloko Ngubane bring to the department, and what impact will her temporary departure have on the all-important tourism industry? Let's discuss this further with William Gumede, Associate Professor at the School of Governance at Wits University. Very good evening to you, William Gumede. What do you make of this? Is it baffling, or am I missing something? Is it a stroke of genius?
Evening, and evening to your viewers. It is baffling. I'm amazed that at this critical moment, when, in the middle of the beginning of a third wave, that we really need a health minister with a technical capability, who's a medical doctor who would understand the nuances of this very complex problem.
Is there nobody in the department who would have been better positioned to have taken over? And if so, why not?
I don't understand. The reason given why she was appointed is that the Deputy Health Minister, the Deputy Health Minister is Dr. Pasla, so he is a medical doctor. So one would think, common sense that he would then become the acting person. But according to the rules, only a full minister can act on behalf of another minister. Now, that is during normal times. And if that is the case, there is still Dr. Aaron Motsoaledi, the former health minister, who's now at Home Affairs. So one would have thought, as the position is so critical, so if another cabinet minister with medical qualifications needed to act, it would be Aaron Motsoaledi. So, really, so it's absolutely, it is a mystery. But there's another element of it. We are still in a state of disaster, which means, from where I'm looking at, that, the normal rules don't apply. And surely if the normal rules don't apply during a disaster, other appointments can be made. You could have brought in somebody like, the former chairperson of the advisory committee, the COVID advisory committee who left, could have been appointed. If one argues this is a state of disaster, normal type of rules don't apply, and people can be brought in from outside the cabinet to be made health minister.
Well, what do you think it suggests about what's happening in government at the moment and leadership decisions?
Clearly it doesn't give us, as the public, the confidence that, minds are applied fully to deal with this crisis, this health crisis, this biggest crisis in our generation, a crisis that we've never seen before, that, we're not going for the best people to deal with, some of the critical areas. And unfortunately also, in that cabinet of President Ramaphosa, he has very limited capacity generally. Many of those people in there are not the most competent people, I'm afraid to say. There are many better people out there in South Africa in this crisis, because we are not in normal times. This is abnormal times. This is, it's an emergency. It's a crisis. So, you can't have ordinary people, running critical positions. This is not a judgment on the current tourism minister, of course, but it is just from a South African point of view. This position should have now been appointed. We should have now gotten a medical person with a medical expertise.
Yeah, that seems incredibly obvious, doesn't it? All right, but that hasn't happened. This is one of the problems in the country anyway, isn't it? That you take somebody from the, tourism portfolio and you plop them in the health portfolio, and the flip-flopping when it comes to portfolios as well. How can you garner so much information in one area and then suddenly switch to another one and be effective?
You know, it's almost the same principle, is within the ANC, unfortunately, it seems to be among the leadership and many members who think all you need to qualify for very complex and for technical positions in government, in cabinet, you just need to have political skills, that's all. And that is also the same issue we find in state-owned companies, where people are often appointed as CEOs or chairs of boards in very technical state institutions without really the technical skills. But the argument is, yes, this person can be trained quickly, or this person was a political cadre, and that means, political skills translate into technical skills. And that's why we're having the crisis in our state, where parts of the state has failed. Many state-owned companies have failed because of that type of principle and that kind of belief.
And it's also, interesting, probably a doctor will be put in this position, but, the tourism industry is also incredibly important for South Africa. You wonder what's going to happen without her there.
Absolutely. Again, it does seem that really, you have to wonder, have minds been applied here properly? Because tourism itself is also very important. If the minister, to pull out the minister now, where, the tourism industry faces an absolute crisis, hotels are closing down, small business are closing down, we're not getting the tourists, our vaccine program is not working, and these days, nobody will come to our country because we don't have a vaccination program. And so we really need critical thinking in tourism also. And to move the person who has been, working in a position at this critical moment, and then move the person into health, it's almost like a double whammy of destruction.
Yeah, baffling indeed. William Gumede, very good to talk to you. Thank you for your time.